Radiotherapy to the bladder is a challenging site because the bladder is essentially a bag that contains your urine, and so that can vary in terms of the amount of urine in the bladder from day to day, even if you try and keep the bladder empty. And also because it's fairly mobile and deformable, if there is changes in other pelvic organs such as the rectum, that can distort the bladder. So just planning at the beginning of treatment and delivering a single treatment means that you can miss the bladder quite frequently, even if you use a fairly big safety margin. So that's the key challenge, is addressing those issues. Fortunately, over the last decade, we've had soft tissue imaging that you can do on a treatment machine, particularly with something called cone beam CT scan, and latterly MR imaging. And that allows you to visualize the bladder day to day and actually adjust the treatment to ensure that you cover the treatment. And actually, by using that information, you can also modify the treatment to minimize the amount of radiation you give to patients, which reduces the amount of volume that's irradiated, the amount of bowel that is irradiated, and therefore hopefully reducing toxicity of the treatment. It's also important to maximize the control of the cancer by combining it with low-dose chemotherapy to sensitize the tumor. And achieving those results of what we've seen in the previous study, and as I mentioned before, obtaining local control of the disease in the mid 80% with that sort of approach.